Coming up,
monkeypox in Canada.
this guy's garage. Like and subscribe.
And so I'd like to ask questions that I know are top of mind for residents in my riding. First of all, monkeypox. Over the past couple of weeks, we've seen an increase in cases. I know it's very concerning in Montreal as well. In Quebec, we've seen some cases on the rise. Can you tell us what the agency is doing to actively work with public health partners to investigate reports of suspect cases of monkeypox in Canada?
Thank you, Mr. Chair, for the question. I will ask Dr. Poliquin to respond to that.
Thank you, Mr. Chair. I would like to reassure Canadians that the Public Health Agency of Canada is taking the monkeypox situation extremely seriously. We have had a number of concrete actions with respect to monkeypox. First, following the international reports from the UK on May 17th, the National Microbiology Laboratory relaxed instantly its criteria for testing to remove the need for travel, to make sure that all Canadians were able to access the testing that they needed. In addition, there was an emergency meeting of the Canadian Public Health Lab Network on May 19th, prior to the confirmation of the first 2 Canadian cases, to ensure that there was readiness on the laboratory side. In addition, we have been working hand in glove with our provincial and territorial partners to provide guidance. Within 8 days of the first cases being detected in Canada, we issued guidance on the prevention of infection, as well as recommendations to prevent spread. Through the National Emergency Stockpile, we have made available vaccination, 3rd-generation vaccines intended for smallpox, but with also an indication for monkeypox, for a targeted vaccination campaign to help reach those that were most at risk. In addition, ongoing communication has been occurring both through provincial health authorities, but also a number of community organizations, in order to ensure that messaging is out, but respectful, that we do not enter into an area of engendering unnecessary stigma. The Public Health Agency stands firmly against stigma generation, and as such, our communication strategy has been very mindful to both reassure Canadians and also get the message out to those who need to hear it.
My constituents are also worried about long COVID, and I understand that there have been some studies recently about the syndrome's origins, the risk factors, the treatments. Can you tell us, I guess Ms. Thompson or anyone on the team there, what steps the Public Agency of Canada, the Public Health Agency of Canada, is taking to learn more about post-COVID, this post-COVID condition, and what the factor of being fully vaccinated, how does that impact subsequent long COVID?
Thank you, Mr. Chairman. Maybe I'll take those in that order. We are at the agency working to monitor and build an evidence base to inform public health decision-making with respect to post-COVID or long COVID. We are working with a number of partners closely to make sure that we build that evidence base, starting with Statistics Canada. We are going to be launching a population-based survey on post-COVID conditions to look and identify some evidence gaps and try to estimate what the percentage of the Canadian population is that is currently experiencing post-COVID conditions. And then we would propose to do a follow-up survey, a second survey with Stats Canada. We're also working with the Canadian Institute for Health Research and also with the Canadian Pediatric Society to look at some options of studies looking at the impact on children. So I think we'll be in a position later this fall to be able to detail the full scope of the work that's underway. We're also monitoring a number of systemic reviews that are happening worldwide as well. In terms of the evidence and how it relates to vaccination, the evidence review by the agency found that the prevalence of post-COVID-19 condition is approximately 30 to 40% in individuals who are not hospitalized for their initial COVID infection. And the current evidence suggests that the prevalence is even higher for those who were hospitalized during acute phase compared to those who weren't. So there is a strong indication that that vaccination helps to prevent in long-term or post-COVID conditions.